This is the 1610th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to the session, and today our guest is Dr. JUMANA HASEEN, AG. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi, and from 7:30 to 8:30, and from 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again, and you can subscribe the same without paying any money. You can share it with your friends, not only with homeopathic doctors, but also with the lovers of homeopathy. The purpose of this forum, as you all know, that is to promote homeopathy or to take homeopathy to every home around the world. And we are about to reach our target in a good way if you support us in that way. So let me come to today's presentation. And today our guest is Dr. JUMANA HASEEN, AG. She has completed her BHMS and is a consultant at Dr. Basil's Homeopathy Hospital. And she is working there for more than 7 years with the clinical experience. And she has presented some of the best presentation in this forum in her earlier editions. And tonight she will be talking about transforming liver health, lifestyle, and homeopathic strategies for NAFLD management. It's a very, very important subject. So let us welcome the guest of the day, JUMANA HASEEN. Doctor. Yes, doctor, you can begin the session.
Thank you, Dr. Danesh, for welcoming me. Very warm wishes to all. So, Doctor, will you please make it Dr. Abida Salam as host too, so that she could say the presentation?
Yes, she is focused now.
Okay. So today's topic is regarding the transforming the liver health through the lifestyle and homeopathic strategies, non-alcoholic fatty liver management, fatty liver disease management. So first of all, why I have chosen this topic, those NAFLD, non-alcoholic fatty liver disease, why I have chosen, it is mainly due to the rising prevalence and its connection to the lifestyle disorders and lifestyle modifications and its potential health risk, which has been leading to further complications. And it has a high opportunity for prevention. If it has been diagnosed in the earlier stage itself, definitely we could prevent the progress. So that is why I choose this topic, this non-alcoholic fatty liver disease. So first of all, let me tell regarding the liver, which is a key player in your body's symphony. So what are all the main roles which has been played by the liver? Detoxification, that all we know, which removes the toxins and waste products, and also, and also the excess substances which has been accumulated in the blood, that also detoxified, and it helps mainly in the metabolism, mostly in the fat metabolism and in the carbohydrate metabolism, and also in vitamin storage process, and for energy production also liver plays a major role. And we all know that it helps in the production of bile, and it aids in the fat digestion and absorption of vitamins. The vitamins, mainly vitamin A, D, E, K, that is fat soluble vitamins, are mainly absorbed and processed stored in the liver. Mostly the vitamin A, it has been stored in the ito cells, and vitamin D has been stored as 25 hydroxy vitamin in the storage form. By absorption from the skin, after absorbing that, it has been stored in the liver cells. Also, the vitamin K which is mainly useful for the blood clotting factors and all. And vitamin E, tocopherol, it is having a high antioxidant property that is also stored in the liver. And also some water soluble vitamins like vitamin B12, cyanocobalamin. So storage of that vitamins also, for the absorption of that vitamin B12 also, the liver plays a major role. And also the storage of glycogen, that is for blood sugar level controlling, storage of glycogen. So whenever we are having a food, the carbohydrates is going inside, the insulin from the pancreas gets ready and gives signals to the liver to store the glucose in the form of a glycogen, glycogenesis. And also when the glucose has been exceeded, it also gives the liver the instruction to store it in the form of fat. And liver plays a major role in immune function too, for filtering the bacteria, viruses, and whatever pathogens entering through the blood. It mainly acts as an immune function. And this liver also helps in the hormone regulation, the mainly insulin and thyroid hormone. How come the thyroid hormone? In the sense, thyroid gland secretes, we all know the thyroid gland secretes T4 thyroxine hormone, which is an inactive form, and the T3, which is triiodothyronine, which is an active form. This T4, which has been converted into the active form, T3, through the process of deionization, it happens mainly in the liver. And also this thyroid hormone, which is released into the blood, when it enters into the blood, it has to bind with the certain proteins. So these proteins like albumin and thyroid binding factors, these globulins, these proteins are all majorly synthesized in the liver. And also, one more thing I want to mention regarding that is the euthyroid form. That is, whenever in the starving stage, the starvation, or whether we are in a chronic illness or during chronic stress time, what happens? The liver signals the T4 to be turned into a reverse T3. This reverse T3 also an inactive form, and this forms a like euthyroid sick euthyroid symptoms, like as if T3, T4 is raised, but TSH, it comes under normal. Under normal level, the TSH will come. So this will create a balance in the thyroid hormone level. It is known as non-thyroid illness and sick euthyroid syndrome. So this is happening mainly due to chronic illness, and also when during the starvation time and all, the liver helps synthesize this type, and this doesn't need any thyroid supplement, because whatever be the illness or the stress or the starvation, if it has been rectified, the thyroid and hormone level will come into balance. So it doesn't need any replacement for thyroid hormone. So I have already elicited regarding the liver function, major liver functions. What are all they? Removes toxins and helps in the metabolism, and also um, the production of the storage of vitamins like fat soluble vitamins, and also it regulates the blood clotting factor productions that also happening in the liver. And our immune system also balanced in the liver. And fatty liver, which has been becoming like a silent epidemic now. So this fatty liver, which is also known as hepatic steatosis, it is a condition where this fat has been excessively accumulated in the liver cells, which impairs the liver function and which leads to inflammation and scarring. So majorly, the fatty liver, in the sense the fat has been deposited, fat metabolism is majorly occurring in the liver. So whenever the excess of fat is there, this fat will be accumulated in the form of triglycerides, and that leads to the fatty liver. So it is a reversible condition, but if left untreated, it can lead to the liver damages, cirrhosis, and other major complications, even to liver failure and the risk of liver cancer too. This fatty liver has been directly linked to obesity, insulin resistance, and metabolic syndrome and other health conditions. So, how it has been linked to insulin resistance? I mean, obesity during the time of when the people more fat has been deposited in the adipose tissue, what happens? The insulin resistance also happens. What is the link between this fatty liver and insulin resistance? How this insulin has been resisting in the fat in the liver. So first of all, I already mentioned regarding the insulin's action. Whenever we are taking a carbohydrate, the insulin will be giving the signal to the liver to process it properly, to convert into the glucose, to convert into the glycogen, and excess more glucose to be stored as fat, stored as lipid. So what happens? This insulin uh, get resistant when means whenever the fat accumulation is more. I mean, in the body's interleukin and the cytokines will be released more. So obesity and excessive visceral fat, this leads to the release of inflammatory cytokines. Inflammatory cytokines in the sense TNF, that is the tumor necrosis factor, TNF alpha and interleukin 6. These will be released and this will release from the adipocytes. Mostly these inflammatory cytokines will be released from the adipocytes, adipose tissues, fat cells, and immune cells, which increase the activity of serine kinase, which leads to the impaired function of insulin receptor substrate, and improper phosphorylation will be happening. And this leads to the impaired insulin action, and excess of fat will be accumulated. Excessive, especially free fatty acids, will be more converted into triglycerides. The proper oxidation won't be happened. The chemical reactions has been interrupted due to the enzyme activity has interrupted, and that leads to the high deposition of fats in the liver. So fatty liver types. So what are all the types of fatty liver? Non-alcoholic fatty liver disease, that's all. That is the one we are discussing now. This is the most common form which has been associated with the obesity, insulin resistance, and insulin resistance. Definitely, it will lead to metabolic syndrome because this insulin resistance also lead to fat imbalance and glyconeogenesis. I mean, the glucose will be new generated from the liver, and fat also will generate fat. Fat will be lipolysis also will happen. So these all will disrupt the total fat and carbohydrate metabolism, and the entire system will be damaged. It leads to the metabolic syndrome. And alcoholic fatty liver disease, which is mainly caused due to the excessive intake of alcohol, and it leads to further liver cirrhosis, liver damage, and inflammation and all. And another third type is the acute fatty liver disease of pregnancy. This is a rare case. That is 1 in 7,000 to 1 in 20,000 pregnancies only happen this. What happened? It happens in the third trimester, mostly in the third trimester or after the delivery. This acute fatty liver of pregnancy, this happens. And it is a very life-threatening condition. So if and all it has been diagnosed earlier, I mean, if it is associated with preeclampsia or eclampsia condition, or it has been associated with HELP syndrome, definitely it could lead to fetal distress and fetal death too. And it will affect both the mother and the fetus, this acute fatty liver, acute fatty liver of pregnancy. Even though it is rare, but still the chances are there. And other forms like fatty liver, which has been associated with certain medications, certain steroid medications, and also toxins and genetic disorders, genetic predispositions. Some people will have a genetic predisposition to store high amount of fat in the liver. Unmasking the non-alcoholic fatty liver disease. So that is who is the main culprit of today's world. Which why I'm telling this regarding this. If and all 10 patients coming daily, we are taking a 8 person's report. most of them, they'll be taking a normal scan, whether it is for infertility cases or whether it is for kidney stone, whatever it be, there will be an impression will be the grade 1 fatty liver. It is so patients and people are more concerned about this. Why is this grade fatty liver has been occurred? Whether it has been recovered, whether I can recover from this, and also whether it will go to further stages. And people mostly what they will think, fatty liver. So we have to reduce the fat. If and all fat has been or a fat consumption is reduced, they think that the fatty liver will be gone. But definitely it's not like that. The fatty liver, its composition, the fat is there, but still the most of the fat, it is mainly due to the conversion of carbohydrate. That is highly due to fructose only. The fructose, which will be mainly stored as fat in the liver. So this is the main reason for high prevalence of NAFLD. That is not mainly due to fatty food intaking, that is high intake of carbohydrate and fructose content foods. And what happens in this fatty alcoholic liver disease? That is, the fatty acids flow will be there, influx will be there. From the adipose tissue also it will be released, and from the dietary fat, what we are taking like oil, everything, the dietary fat also will be there. And also, as I told you that this fat will be released and formed from non carbohydrate things also. So de novo lipogenesis, new fat formation from the stored glucose also will be there. This all lead to release of fatty acids. These fatty acids, which will be like a lipid droplet, with the help of acetyl coenzyme A enzyme, it will be going through oxidation process. And if this oxidation is interrupted, it will be converted into triglyceride secretion. So mostly this triglyceride has been excreted as very low density lipid. Only if it is this production of fatty acids like a lipid droplets, which has been the fatty acid oxidation is not occurring properly, this VLDL, very low density lipid formation of triglycerides, which will be increased more, and that will be further accumulated in the liver. So definition, we'll go for the, what is that already I have told? Excessive fat accumulation in the liver cells. It is mainly not caused by alcohol consumption. That is what we have to highlight, because whenever the patient is approaching you, doctor, I'm not taking the alcohol, but still my liver is in this stage. So without alcohol consumption itself, it happens. It's mainly due to excessive obesity and sedentary life, and without any physical exercises, and also excessive fast foods that will lead to more cytokine releases, and anti-inflammation process will be more, and that will interrupt their immune level too. And prevalence, so it affects 25% of the global population, with increasing rates mostly in the western countries too. And the pathophysiology, I have explained it, that is insulin resistance, metabolic syndrome, and genetic predisposition, which is attributed to accumulation in the liver cells. So what it can impact? This fat deposition without any alcohol consumption, how it can impact? It can, whether if it is not treated at the initial stages, at the grade 1 or in the beginning stages, if it is not treated, it may lead to liver inflammation, scarring, and potentially liver failure and liver cirrhosis too. And it also affects liver, and it also damages the liver too. Types of non-alcoholic fatty liver diseases. So what's the type of non-alcoholic NAFLD? One is the fat accumulation only the fat accumulation is there. And another one is NASH, that is steatohepatitis, where this fat is accumulated more, and it gradually lead to the inflammatory stage, and also the cell damages. Causes and risk factors for non-alcoholic fatty liver diseases. So what is the main causes and risk factors which lead to this fatty liver disease? First one is the insulin resistance, and second one it is the obesity and the high fat diet. High fat diet, mainly the saturated fat. Saturated fat we are having more. It can promote for fat accumulation. So unhealthy fat diet and obesity. Obesity definitely it will be increase the the when the body's fat is more, the adipose tissue, it will be what happens, the body's normal capacity will be there to store the fat. Whenever it exceeds, it will search a place to accumulate its position. So it will mostly accumulate in the visceral organs, that too in the liver, mostly in the liver. Other organs also it will be deposited, but mostly it will be deposited in the liver. And this inflammatory cytokines are very dangerous. It will be further leads to a blockage of insulin's action. So insulin plays a major role. So this insulin resistance happens and it may lead to type 2 diabetes and cardiac complication and also metabolic syndrome, uh, and obesity and high fat diets and sedentary lifestyle. So without any exercise, sedentary lifestyle, it will be definitely lead to increase in your insulin resistance. Also, it will highly increase your fat accumulation too. And other risk factors, type 2 diabetes, insulin resistance. So the insulin resistance is the major factor for this NAFLD, non-alcoholic fatty liver disease. And dyslipidemia, that is high triglyceride level and low HDL. Mostly this type 2 diabetes, patient with diabetes and a non-alcoholic fatty liver disease and high increase in triglyceride level. These are all associated. So if and all we are going through the reports of diabetic patient, type 2 diabetes patient, cholesterol reports majorly, even though the LDL, HDL, it is under balance, this triglycerides will be very high. So why this triglycerides is high? Mostly the blood glucose, the insulin is not acting properly. So this glucose will be converted into fat. This fat will be accumulated in the form of triglycerides. So that is why these three are mainly linked. That is the dyslipidemia, increased level of triglycerides, and type 2 diabetes, and also insulin resistance and non-alcoholic fatty liver disease. These are all associated with not maintaining proper body mass index, that is high obese people, also without any workouts. Why means when we are doing workouts and proper exercises, the muscle will be storing this glucose as glycogen. So muscle plays a major role to convert this glucose into glycogen. So thereby, the fat will not be much accumulated in the liver, and we can reduce the NAFLD, non-alcoholic fatty liver disease. Also, the insulin resistance can be improved by means of physical activity. And polycystic ovarian syndrome. So PCOS, you all know that PCOS hormone imbalance will be there. Again, in the PCOS, there comes the insulin resistance. So this insulin resistance is the major factor. And the genetic predisposition. So genetically, some persons will be more prone to fat depositions. Even though the person is more lean, there is a chance for them to have high cholesterol level or high triglyceride level and non-alcoholic fatty liver deposition too. And its pathophysiology. So stepwise progression. So lipid accumulation, excess dietary fat, or inability to process fat. So this fat metabolism is majorly occurring in the liver. If it has been accumulated more than its capacity, definitely it will be disrupt the metabolism, and insulin resistance leads to the fat deposition in the liver. Oxidative stress. So this oxidative stress will be leads to damage of liver. by releasing more free radicals. And inflammation activates the immune response, like inflammatory cytokines also there. Also the interleukins and TNF alpha and IL-6, these cytokines will be released. The inflammation process will be more, that is released from the fat cells, that is adipose tissues. And this will worsen the fatty liver condition. This will lead to fibrosis, cirrhosis, and often it leads to scarring and replaces the healthier liver tissues. So this is the pathophysiology of non-alcoholic fatty liver disease. The main factor is the insulin resistance, and also this obesity factor, hyperlipidemia, this all diabetes, this all contribute for the steatosis, that is the fat deposition formation, and also leads to cirrhosis process, necrosis, and scarring will be there. Signs and symptoms. So what is the major signs and symptoms of non-alcoholic fatty liver disease? Mostly it will be asymptomatic. So only when they have been gone through for any other purposes, if they are doing a scan, only accidentally they will find it as they are having a alcoholic, non-alcoholic fatty liver disease. Fatty liver is there. They'll be diagnosed. So mostly it will be asymptomatic in the early stages. But when it is left untreated, without any proper exercise or without any diets or without any medications in the later stages, it will be going to advanced stages, like what it happens, it will disrupt the entire liver and fat and carbohydrate metabolism. So it will lead to fatigue and weakness, and also mainly seen the pain and discomfort will be seen in the upper right side of the abdomen. Unexplained weight loss will be there. These are all only on the later stages, not like fatty liver in the initial stages, there won't be any symptoms. Only in the later stages, unexplained weight loss will be there. That might be a stage of cirrhosis, or it has been led to a liver cancer stage and all. And jaundice, it is also seen only in the severe cases. And diagnosis of non-alcoholic fatty liver disease. So how it could be diagnosed? So first of all, we could take the history like lifestyle, and whether we can also take the alcohol consumption, whether they are doing alcohol consumption, and risk factors. Their familial history is there. And the physical examination, signs of obesity, mainly this fat tissue which has been accumulated in the central portion. Those type of obese peoples are more prone for this non-alcoholic fatty liver disease rather than complete obese people. Some people that like the apple shape and pear shape of obesity will be there. So fat deposits, which is more seen on the abdomen, those people have higher chance. And hepatomegaly also. So this is all the clinical evaluation. By seeing a person, we could tell like this person will have a chance of NAFLD. And laboratory test, what we'll be doing it is mostly elevated liver enzyme, that is SGOT and SGPT. Mostly SGPT will be raised in the non-alcoholic fatty liver disease. Why not SGOT in the sense? SGPT is the main person. SGPT or ALT, it is more precise or peculiar to liver cell injury, liver damages. It is mostly found only in the liver. So when the liver gets injured, this SGPT or ALT will be raised. Whereas in case of SGOT or AST, what happens? It is also found in the kidneys, muscles, and heart, and other organs also. So SGPT will be mostly raised. And also by seeing the ratio of AST and ALT, that is SGOT versus SGPT. If you are seeing the ratio in non-alcoholic fatty liver diseases, it will be less than 1. Less than 1 will be there. Whereas in alcoholic fatty liver disease, that will be greater than 2. This AST, ALT ratio will be greater than 2. So that is the one we could do the diagnosis, and also we could check the lipid profile test. Lipid profile. So low level of HDL, high density lipid, good cholesterol will be low, and VLDL and LDL is raised, also highly raised triglycerides. Elevated triglycerides is a significance for non-alcoholic fatty liver disease. But still, if we want to confirm, definitely we want to go for imaging techniques like ultrasound and also MRI, CT, liver biopsy, fibroscan also available. It's mostly what the people will do, patients will be doing, they will be doing a USG, abdomen and pelvis. So we could diagnose that fatty liver grade 1 or grade 2 or grade 3, grade 4 is there. Even fibroscan is also available. A liver biopsy, which is a gold standard for confirmation of NASH, steatosis hepatitis is there or not, or fibrosis stage confirmation and all. Liver biopsy is a gold standard one. Generally, for a mere NAFLD, we'll be going for ultrasound USG. First line for detecting the fatty liver is this one. And also, the next one is the grading and the staging of this NAFLD. What are the grades and the stages? Mostly 3 grades will be there. Grade 1 and grade 2 and grade 3. Grade 1, what happens? It is the fat deposition will be mild. That is, in the sense, 5% to 33% of fat deposition will be there in the grade 1. Whereas when we are going to grade 2, moderate infiltration, like above 33%, up to 66% of fat accumulation will be present. And in the grade 3, more than 66% of fat accumulation, which is very severe form of fat deposition. These are all the 3 gradings. And the stagings. Stagings of non-alcoholic fatty liver disease are, first one is the stage 0, no fibrosis is there. And stage 1 to 2, where fibrosis will be there, which is in a mild to moderate level. And when we're going through stage 3, there will be a severe fibrosis will be there. And in stage 4, there is a cirrhosis. Chances of cirrhosis is more in stage 4. Complications of non-alcoholic fatty liver diseases. So what are all the complications of non-alcoholic fatty liver diseases? In the short-term risk, what happens? I told it's in the ongoing. For the next stage, it will be going to liver inflammation stage. That is NASH, non-alcoholic steatosis hepatitis will be there. And the long-term risk, if it is not treated or if it is not interfered by proper diet restrictions or lifestyle changes, it will lead to long-term risk like fibrosis, cirrhosis, and even to liver cancer, hepatocellular carcinoma will be there, and cardiovascular diseases, which is the common cause of death in non-alcoholic fatty liver diseases. Then, while going for a dietary management of non-alcoholic fatty liver diseases. So what are all foods we want to include in it and what are all to avoid? So what are all food we include? High fiber rich foods, vegetables and whole grains and also healthier fats. Healthier fats, omega-3 rich fishes and omega-3 fatty acid rich nuts also can be taken and seeds like nuts and seeds like sesame seeds and chia seeds, which is very much rich in omega-3 fatty acid. Also, avocado fruit. Avocado fruit is having a high level of good fat. So avocado fruit can be taken. And lean proteins, the proteins which are like poultry and legumes can be taken. And antioxidant rich foods. Antioxidant property rich foods are mostly in the berry fruits, like blueberry, blackberries, strawberries, and all. Of course, gooseberries also, but it is highly rich in vitamin C too. And green tea also, turmeric, which is having the more anti-inflammatory property and also it has got a high level to reduce the insulin, to increase the insulin sensitivity also. It has the capacity for that. Curcumin. And what to avoid. So what foods we want to avoid uh, when we are having or when we are prone to a fatty liver disease. First one is the trans fat and saturated fat processed foods we have to avoid, and sugary drinks and desserts. This is the must thing we have to consider. That is mostly this sugary drinks and desserts which we are obtaining from outside or in the fast food and packed food. There is a high rich possibility of high fructose content in it. This high fructose content will definitely disrupt the metabolism in the liver and fat accumulation too. So even though we are taking homely foods and all, not taking any fat food, we have to go through what are all the food we are taking daily. In the packed food, that will be very clearly mentioned how much fructose content it will be. And so sugary drinks and desserts should be avoided, and alcohol and high fructose corn syrup. This is the main thing I want to tell you. High fructose corn syrup, it is very cheaply available. As compared to the normal sugar, sugar, where the fructose level will be less. That's what we are having in our kitchen. In that sugar, the fructose content will be less. Whereas this high fructose corn syrup, this is what most commonly used in all the like ketchups and pizza sauce and cocktail peanuts and canned foods, also salad dressings and all. This is the main thing, high fructose corn syrup. So while we are telling the patient to reduce high fructose, please reduce high fructose corn syrup, they don't know. They'll be thinking like, okay, I'm not taking any corn syrup. No, it is indirectly going into our body through all these. And also in the sweetened yogurt, bread, even in frozen pizza, every all items, this high fructose corn syrup is more. And also the soft drinks and soda, the fruit flavored drinks and pastries and baked items, which most of the people are more addicted to that now. So, and condiments and snacks, all this pancake syrup, everything is having this uh, high fructose corn syrup. So, if you want to get rid of this fatty liver disease, non-alcoholic fatty liver disease, definitely have to check what we are having. Mainly the packed items, what we are taking, that we have to consider more. And dairy products also, that's already a told. Ice creams, sweetened dairy drinks, like even in condensed milk too, this high fructose corn syrup is having. Why they are preferring that? It is mainly cheaply available. One thing, it is very cheaply available. And also it enhances the sweetness production. It enhances the sweetness, double time sweetness than the normal sugar. And also it improves the shelf lives. So most of the packed items and products are having this high fructose corn syrup that we have to strictly avoid. Lifestyle modifications. So what are all the lifestyle modifications we can go through? First thing is the weight loss. Weight loss in the sense we have to be maintain a proper body mass index. So target for 5 to 10 percentage reduction of body weight. And while going for the weight reduction, you have to consider it as you have to reduce the weight gradually to avoid the worsening liver inflammation. Sudden weight loss like keto diet and like some people they have to they'll be thinking like they have to reduce the weight, so they'll be going for a continuous fasting and not taking proper proteinaceous or proper food, which may worsen the liver inflammation, which may um, entirely worsen the metabolic condition of the liver. So while losing the weight, should be concerned about the gradual weight loss is very safety one. Sudden weight loss and sudden weight gain, These are all more dangerous only. Physical activity, aerobic exercise, and resistance training. So, how this physical activity is helping? Aerobics exercises and strength training. Physical activity will be mainly helping to reduce the hope I'm audible. Am I audible?
Yes, yes, everything fine. Everything fine. You can go ahead.
Okay, right. So, how this physical activity, which is helping in non-alcoholic fatty liver disease, in the sense fat burning. First of all, it helps in the oxidation process, lipid oxidation. It will increase the fatty acids not to turn into triglycerides. So it will help in the more oxidation, and it improve the insulin sensitivity. And exercise also improves the muscle insulin sensitivity. Like what I have told, while you work out more, this muscle will be storing this glucose into glycogen, and that improves the muscles sensitivity, insulin sensitivity. And regular physical activity also help in the anti-inflammatory effect. It acts as an anti-inflammatory effect. So main exercises which will be referring or will be telling for a patient who's prone to non-alcoholic fatty liver disease is aerobic exercises and strength training exercises like weightlifting, and also HIIT, that is high intensity interval training. So high intensity interval training in the sense short burst of intense exercise will be there. Short burst of intense exercise which has been followed by a brief period of rest. This will help in the improve the immunity, also fat to burn well, and the lipid oxidation also it helps. And the physical activity also helps in the reducing the visceral fat and liver fat, and decreasing the inflammation and oxidation stress. It also promotes the weight loss and preventing the progression of non-alcoholic fatty liver disease. One more thing which is mainly leading to NAFLD is also the cortisol, high level of cortisol, which is mainly increased due to stress level. So nowadays, due to lifestyle changes, due to very hectic lifestyle, this cortisol level might be raised for most of them. So that is why the NAFLD prevalence is also got higher level, in higher range. And stress management. So how could we do the stress management? By means of yoga, meditation, and counseling, and all that, we can do a stress management. So stress management of stress level only, we can reduce the cortisol level, and thereby we can promote the high resistance, high sensitivity for insulin. Thereby we can reduce the resistance, insulin resistance, we can reduce it. So these are all the main lifestyle modifications.
Hello.
And homeopathic remedies for non-alcoholic fatty liver disease. So most of you will be knowing that, but still I'm explaining a few remedies. Cardus marianus, which is in the 3x or 6x potencies, as giving a good result in reversing grade 3 up to grade 1. From my experience, I'm telling. So Cardus marianus will be helping in the liver congestion and patient with the pain and detoxification. And Chelidonium majus, which is a major liver remedy, gallbladder issues with jaundice and all, we can prescribe this. And Nux vomica, fatty liver from sedentary lifestyle or fatty liver due to alcoholic consumption, that we can think of the Nux vomica. And also Lycopodium. So Lycopodium, it is a major liver remedy, polycrust. So this will be helpful in patients with much more indigestion and indigestion and flatulence with liver complaints. And another one is Andrographis paniculata. The Indian name is Calmec. So that also in the 3x and 6x potency, that is majorly useful. Also the curcuma longa, allium sativa. Definitely allium sativa is containing the allicin. It is also majorly helpful. And moreover that, as we were, when we are going for homeopathic remedies, individualize the patient and according to the patient constitution, we can go for that. And also some home remedies like we can give it to the patients as a suggestion. Turmeric, it has got a anti-inflammatory and antioxidant property. Definitely we could also use curcuma longa too, and this turmeric contain curcumin. This curcumin chemical constituent has got anti-inflammatory and antioxidant property. So turmeric milk that we can suggest, that will be much helpful to reduce the fatty liver in the initial stages. And apple cider vinegar, which is also helping more patients. Apple cider vinegar, it reduces the liver fat and it acts as a liver detox too. So 1 or 2 tablespoons of apple cider vinegar, which is mixed in a glass of water. It is to be mixed. It has to be taken before meals. Then only the blood sugar level balancing and digestion improvising everything will be in a proper way. And it can be also used for dressing the salads or not. Apple cider vinegar and garlic. Garlic, it is contains allicin, antioxidant and anti-inflammatory property. So 1 or 2 cloves of raw garlic can be taken in the fresh form. Mostly this garlic and ginger, these condiments and all, what happens means when it is being cooked, its effect has been lost. So half cooked and in the raw, we can take ginger also, ginger tea and all we can have as a fresh thing. Without much cooking, it will be benefit. And also beetroot. Beetroot contains the betaine. Beetroot juice also reduce the oxidative stress and inflammation in the liver. So taking beetroot juice also helping the patients. And avocado, suggest avocado, olive oil to be more include in the diets. And monitoring and follow up is very much mandatory. So regular checkups. So liver enzyme levels, as I told, SGOT, SGPT can be checked, and other parameters like triglyceride levels and lipid profile, everything we can check. Patient education is very must. The importance of adherence to this is a, so we have to educate the patient must regarding the lifestyle change. This is majorly due to a lifestyle changes and treatments. And coming into the conclusion, non-alcoholic fatty liver disease, it is largely preventable and reversible when it is being detected in the early stages. And lifestyle modification is mandatory and it remains the cornerstone for management. So NAFLD, even without medication, only with a lifestyle modification like intermittent fasting and proper workouts and exercise and having proper nutritious food intake and weight reduction. I mean, coming into a proper BMI and all, definitely due to by means of this lifestyle modification, we can manage this non-alcoholic fatty liver disease and multidisciplinary approach. This diet, exercise, medication, uh, homeopathy is essential. So diet, exercise, doing 1 day and another. I mean, if you're going on to the diet also, 1 day just we are following that and skipping for another 5 or 10 days. That type of approaches definitely won't helpful for managing this. Then they have to definitely depend on the medicinal therapy. Early diagnosis definitely prevent the complication of further cirrhosis and liver cancers too.
Yes. 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 Thank you.
Thank you.
Dr.
Thank you.
JUMANA Hussain. It's really a very good session indeed. Please stop the screen sharing, Dr. Abida Salim. Yes. As we all know that this is one of the commonest problem nowadays people faces because people believe that the alcoholism can is the only factor that makes these liver problems, but unfortunately it is not so. We have this problem. There are many patients who are having the liver cirrhosis and liver problems even without alcoholism. So we will have to think about that also. In mind, there are we know that a lot of chemical medicines are taken into the food as just like they are taking food. So that may be another reason. Anyway, it's the time for discussion. I invite the participants to join the discussion. Only few minutes remaining. Yes, Dr. Indran, you can begin the session.
Yeah. Thank you, sir, for allowing me. I'm Dr. Bavdekar from Pune. Madam, two small questions for you. Number one is, does this fatty liver disease have correlation with cholelithiasis? That is the first question. And second question is this, that many patients are asymptomatic when they come to us. There are only sonography reports show fatty liver and there are no symptoms. So how to approach such cases? Should we give only mother tinctures and diet lifestyle or any specific medicine for that? Kindly explain it.
Yeah, thank you, doctor. Thank you. So the first question is regarding any relation with the gallbladder stones or under this fatty liver. Definitely, it has been related. Definitely, it has been correlated only because as this non-alcoholic fatty liver disease is mainly due to lifestyle changes. That is only leading to gallbladder stones, so cholelithiasis. So most of the patients who are having this cholelithiasis, when we are going for the USC, there is a correlation with that. They're also having this fatty liver disease is there. And specific medication in the sense, that's what I have told you. It's not like this in the starting stage for up to grade 2 and all, we can suggest them lifestyle changes and simple home remedies and all. No need for medications. Definitely, it could be reversible. When they are when they are going to a like a grade 2 rather than grade 2, and if the patient is on high risk category like obese and he's also having diabetes and all, definitely we could add our medicines. So that's what I have told you. We can go for constitution remedies, but along with that, what I have got a result with the patients is that curcuma longa tincture is getting curcuma longa, also Cardus marianus and Calmac, that is Andrographis paniculata. That is from my experience only. I'm telling this. Calmec, that is Andrographis paniculata, is a long-term Ayurvedic herbal medicine which is mainly meant for liver only. So that is giving a high result, good result for reversal of fatty liver.
Fatty liver disease. Okay. Thank you, madam, for the explanation. Yeah.
Well, now it's up to Dr. Manoj.
Thank you, Dr. Dhanesh. It's quite interesting and very happy to see the young doctors working hard. But I have some doubt about that. You mentioned about using these condiments, garlic and ginger, while using homeopathy medicines. I think that is not rational because it was interdicted by our master. However, spices and condiments must altogether be avoided. Please read the chronic disease. It was strongly mentioned there. So
Yeah.
whatever we do, there is no problem. But it should be according to the instructions of the basic homeopathy instructions. Without that, homeopathy is not viable. So we will
I have
be always cautious about that.
homeopathic remedies before prescription, before as a home remedy you can take. Not along with homeopathic medicines, I won't suggest patient to take garlic or ginger in the raw form. I won't suggest.
Yes, in the raw form. That's most important. Okay, thank you.
Without-
Okay, so it is the time for wind up the session. I invite Dr. Abida Salam to say a vote of thanks to the session.
Thank you, Dr. JUMANA, for your wonderful session, which you have explained in detail from the basis to the initial till the grading and all the management, including the homeopathic management. You have explained it wonderfully from each and everything systematic way. Thanks a lot. And thanks to all the participants who have been with us till this continuation of the session. And thanks to everyone who have suggested and given all the points added to the points on this. Thank you all.
Thank you, Dr.
Thank you.
Abdasalam.
Thank you, Dr. Abida. Dr. Jumana, you want to say anything more? You can say.
Yes, thank you, Dr. Danish sir and IFPH team. And thank you, Abdusalam sir. And thank you, Dr. Basil Homeo Hospital team and Dr. Abida Salam and all the participants. And thank you once again. I thank IFPH team for giving me this opportunity, wonderful opportunity. And I'm looking forward for more sessions too. Thank you. Thank you, everyone.
Yes, it was Mr. Abdus Salam sir has brought you here in this forum. So you can say a few Yes. Okay. Okay. Thank you.
Thank you, Dr. Jumana.
Thank you, Dr. Jumana, Dr. Abidza Salim, Dr. Manoj, Dr. Bavakar, and those who attend the session in this evening. And tomorrow at the same time, we will have a session from Dr. Neha Katadia. She is working as an assistant professor, Department of Materia Medica, GD, and Gareria Homeopathic Medical College, Gujarat. So we'll be talking about scope of homeopathic medicine inside India. So another big day is waiting for you. I hope all of you will be joining us at the same time by using the same link that we use nowadays. Thank you all. Good night. It's over to Dr. P. Shaila to